today they've just reported a bit over 7,500 new cases confirmed today. That includes 23 deaths, including, very sadly, the death of an 11-month-old baby. The key thing to note with these numbers is the real number is likely much higher. What they are doing now is they're no longer counting preliminary positive cases. And what that means is Hong Kong used to have a policy of seeking a confirmation of every test that came through, regardless of what sort of test had been done. They have now decided to do away with that because the backlog created was so large that they were, it was creating these enormous backlogs with thousands of cases and test results not coming through. So the sense now is that the numbers are actually much higher, but we are still seeing these numbers sort of double every 3 days.
And then what sort of flow-on effect is it having on the health system?
Well, even when the daily cases were around 2,000 a day, or the reported cases were around 2,000 a day, it was already having a very extreme impact on Hong Kong's health system. Essentially, under the weight of these cases, Hong Kong's hospital system collapsed last week. And that was when we saw those really tragic images of elderly people in gurneys outside hospitals in the car park. It's very cold at the moment. It has been wet in the last week as well. But the other side of that is there is also a backlog of about 30,000 people who are waiting to get into isolation accommodation. The current policy is that anyone who is COVID positive must be isolated either in hospital or at a government facility. Now, there are just simply not enough rooms, either in hospital or in government facilities, to house everyone. And so we're seeing this backlog of people who have been told to wait at home and isolate. Now, Hong Kong's apartments and accommodations are famously quite small, and so this is very difficult for a lot of people who live with large families. We're seeing a flow-on effect of domestic workers who live in with their employers. And I've been speaking to people today who have told me that there are more than 60 domestic workers at least who have come forward because they've actually been fired after they've tested positive because people are too scared to let them come back home and stay in their apartments. So there are a number of very alarming knock-on effects from what's happening here in Hong Kong.
And these orders, are they coming from China, which we know has pursued a very strict zero-tolerance approach? They've been quite brutal in the shutdowns that they've gone through.
So I think it's important to note that there is a big difference between the way that China is running their response and Hong Kong, which is separately running their own response. They both have the same goal. Hong Kong is also aiming for zero COVID, and it's actually a key requirement of Beijing that Hong Kong have zero COVID before Beijing opens its borders to them. But Hong Kong has actually been quite successful in their strategy. In 2020 and 2021 combined, they had less than 15,000 cases. So the issue now is not so much that their COVID strategy was wrong, but there are criticisms now that perhaps they had failed to anticipate that their COVID zero strategy may not stand up to Omicron, which we had already seen, ravage countries around the world. And so, the blame or, the questions being asked about this are sort of very firmly landing at the feet of the Hong Kong government. The Chinese government has offered assistance. They are planning on helping to build one of the very fastly built mega hospitals, a temporary hospital to help treat those who are sick or who need to be isolated. They've also provided millions of at-home tests, and there are reports that they will be sending over health personnel as well. But this all was in the context of a very strict security environment, which people have said that the Hong Kong government was perhaps more focused on than preparing for what might have happened when Omicron broke through.
Yeah, interesting. And in terms of vaccination, are there high levels of vaccination in Hong Kong? And is it mostly Sinovac?
So Hong Kong's vaccination levels, it's relatively high across the board. It's around 75%. The issue is the demographic split. And so actually the elderly populations they have very low rates of vaccination. Those who are over 80 are vaccinated at rates of as low as 30% last week. And that's been put down to a range of factors. But the issue in the end is that the most vulnerable population right now are the ones who are who are vaccinated at the lowest rates.
Really interesting to watch, Helen. We'll keep an eye on it. Thank you so much.
Thank you.